Welcome back to Inspire Great Health. I have Dr. Rage Geringer with me today, and he is a pulmonologist with Cheyenne Regional Medical Center. How are you doing today, Dr. Geringer?
I'm good. How are you?
Doing great. Pleasure to have you back.
Yeah, thanks for having me.
Of course. So today we're going to be talking about the Galaxy system. So the Galaxy system is a robot-assisted technology that helps discover lung cancer. Tell me about this exciting technology.
Yeah, we're really happy to have it here. We're the only ones in the Front Range that have it. It's a robotic bronchoscopy platform, meaning that if somebody is discovered to have a spot or a lung mass or a nodule in their lung, it allows us to go from the inside out to biopsy and drive further out and biopsy smaller and smaller lesions to detect lung cancer smaller and smaller.
Okay. And when did you start using this technology?
We did our first case here May 1st. So that's the first case that I've done with this specific platform. There's a couple other platforms out there that I trained on in training. But Cheyenne Regional's first case was May 1st.
Okay. And how many patients about do you think you've helped with this?
We're just over 90. Our 100th case will be on Tuesday, I believe.
Okay, wonderful. So that's coming up. So this is really exciting technology. So you have live imaging when you are doing the biopsy. Is that correct?
Yeah, we have two things that really set us apart from the competitors, and one is that I never lose view of the airway while I'm driving out there. So I always have direct visualization of what I'm biopsying and where I'm going. And then we use a C-arm, a special X-ray during the procedure where we biopsy and then image to ensure our needle is exactly in the middle of the nodule and that we know we're biopsying. Because when you're biopsying things that are less than the head of a thumbtack, we need the most accurate imaging that we can get, and we have that here.
And tying onto that, you recently discovered a nodule that was so small, nobody else has discovered a nodule that small using this specific technology. Is that correct?
Yes, that's pretty cool. So, when I first started training, we used to think that we biopsied 10 millimeters, and then it was down to 8 millimeters, and then you hear about 6 millimeters, and we know that cancer starts at 0 and goes up, and so we had a PET avid lesion from a patient from Casper Oncology, and it was 4 millimeters, and I said I would give it a shot, and we were able to get a diagnosis of squamous cell carcinoma on our first pass through. And as far as I know, it's the smallest documented positive biopsy.
That's fantastic news. We're moving so forward in cancer detection that is great news for those patients.
Yep.
And this is kind of an exciting part. It's kind of fun. The controller of the system is shaped and kind of functions similar to an Xbox. Is that correct?
No, it is an Xbox controller.
It is.
It's made by Microsoft, and it is actually cheaper for them to leave the left-handed D-pad on the controller, so it does absolutely nothing for me in the OR other than it saves them money to not have to make a specific controller without it. But so it is made by Microsoft, and it's exactly like gaming sometimes.
Yeah. Were you a gamer when you were younger? Are those gaming?
Not as much
really?
as you expect.
Okay.
Off and on.
Is there anything else you would like to share with me about this technology?
Yeah, I think an important piece is how safe it is, right? So, the old school method of biopsying these things is to go through the chest wall. And my analogy that I use with people in clinic all the time is, if I blow up a balloon and I stick a penny inside that balloon and I ask you to get it out of there without popping the balloon, how are you going to go through? And hopefully most people answer, I'm going to go through the stem of the balloon and not through the wall of the balloon. And the lung functions much like a balloon. And so the safety of this allows, when we go in and biopsy, the lack of collapse of a lung. So if we were to go through the chest wall, we know our risk of a pneumothorax or a collapsed lung is about 20 to 30%. With our technology, it's about 0.5%, so 0.5%. And knock on wood, we've never had one here, which is nice. And then same with bleeding. We know that it's extremely safe. And so it allows us to biopsy, give a patient a diagnosis, and then I can also stage all of the lymph nodes at the same time. And so it's a one-stop shop, and we know that speeds up your diagnosis to treatment by about 7 weeks doing it this way. So.
That's fantastic. Well, I'm very excited that you're using the Galaxy system and helping out our patients and just overall doing a fantastic job. And I appreciate you coming in and talking to me about it.
Yeah, thank you very much.
Thank you. And thank you for tuning in, and tune in next time.